our response is actually sooner than the 72 for most patients.
Where would a new military spouse learn how to use MyCare or get all the information that he or she should be familiar with?
If you go to our Facebook page, there's a MyCare button. You can push on it and follow the instructions on that.
When you say our Facebook page, 6 Medical Group?
6 Medical Group has MyCare on it, yes.
Good deal. Patient advocates never call you back. Still waiting 7 months.
I recommend you make another phone call to us, either to the patient advocate, to whoever's, hopefully you've seen somebody in 7 months. So if you have, just leave a note at the front desk if you're not getting through the phone, or you can call the patient advocate, make that happen.
Yeah, and if that's happening, you can use the Commander's Action Line, which is always listed in the base paper and online. But please send me a note via the Commander's Action Line. Let me know when you called, what number you called, the day and time, and we'll figure that one out. You should be getting a call back. We're a special needs family and have a case manager for our referrals and love it. Who is eligible for this service? It is a life changer, and I'm guessing that's well.
So depending upon the type of patient or the patient's acuity, you will be assigned a case manager. If you feel that you need one or you would like to have your care managed differently, we can always entertain that. Depending upon if you're in family practice, it might just require you to move to internal medicine, but we'd be happy to entertain any of your concerns and look at your health record and have our chief of the medical staff kind of weigh in on the specifics of your care.
Getting short notice appointments. What's a reasonable wait time for an appointment?
A reasonable wait time for an appointment?
I guess not wait time.
As in sitting in the outside
no,
of the clinic?
It sounds like the issue is getting a short notice appointment. So from when you call and say you have an issue to being seen. Or getting that appointment.
So when it comes to appointments, is if you have an acute issue, the requirement is that we provide care within 24 hours. If it's a routine appointment or requirement, then we would have 77 days to provide the care. If we don't make that happen, then we can refer you to the network. We are actually going to be making some changes to our appointment styles, meaning that we're going to have only acute and established appointments. We have what's called a well, which is kind of your school physicals, and those take a little bit longer, so we're going to be adjusting our schedules and trying something a little bit different with only acute and established. It kind of gives us different parameters to play with that should actually improve things. We've also opened up our appointments from 30 days to 90 days, effective last week.
Hey, Captain Greco, are you guys able to copy the MyCare link off of their Facebook page and just drop it on the MacDill Air Force Base website? We'll put the MyCare link up there.
You call the nurse.
All right.
Yes, if you have a true one, yes.
How about another question from Facebook? Is there anything out there? You got anything from Facebook that we should address? Anything from in the room here that's maybe not necessarily up on the screen? Anybody just want to ask a question or get some clarification on something?
With regard to these, some of the comments that say I'm not getting a response, the TRICARE has a nurse advice line that if you call them, they even after hours, 24/7, and you have an issue and you don't feel it's being addressed, you can leave. You can discuss that with them, and they will put a TCON in. So we should have the ability to follow up with your questions with regard to that.
And I would ask anyone who is having difficulty reaching someone or getting a response to take down the date and time they called and the number and let us know the specifics, because it's much easier to take action on that than it is to try and figure out exactly where across the medical group it may have happened. But that's the last thing we want. So, do you need a CAC to gain access to MyCare?
No, you don't.
The answer is no. All right. And why can't you book an appointment at the front desk?
We actually do book appointments at the front desk. Typically it's the follow-up. So when you're being seen at the end of your visit, we are trying to coordinate your care on the way out.
All right. All right, from Facebook, I would also like to see the AC issue better taken care of. In the last month and a half, our AC has gone out 4 times, the 4th time being tonight. Maintenance is on their way out. It's frustrating for this to constantly happen. I'd also like to know if the ADA houses in Chevron Park will be equipped with garage door openers. I live in one and have to manually open and close the doors. It seems we're the only neighborhood that has ADA houses with garages that do not already have the garage door openers installed.
The Chevron Park home, ADA homes, were Milcon homes. They were not installed with any type of garage door openers. We have installed 2. All they have to do is fill out a special request form, and we're happy to provide those if they want to call the 840-2000 number, fill that out, it gets approved, we come out and install it for them. We've done that in 2 homes already.
All right. For the air conditioning, if you have a recurring maintenance issue, the same issue over and over again, is there anything that can be, like, how many times would you have to go before you could do something?
ACs, unfortunately, are a little complex when you talk about repetitive issues. We would never, knowingly let one part of an AC go out more than one time without replacing it completely. Unfortunately, those problems, they're very complex units. It could be the condenser. We've replaced plenty of those. But we do have a PM program that we go through, suck out all the drain lines from the outside if we can't get into the home. But we schedule to come in, put pan pills in, check coils. We'll go ahead and clean the coils if need be. So we have a preventative maintenance program also.
All right,
To answer your
thanks.
question, we would not let more than one component go out more than once without replacement.
Good deal. Thank you. All right. Only 2 issues I would bring up if I was able to attend. However, since my husband is leaving on deployment, we're spending time together. One issue is the high turnover with PCMs at the Brandon MacDill Med Clinic, and it seems they're always understaffed. Issue 2 would be Key Spouse Program. I don't know where to begin with that. Seems the squadron is too busy on daily flying schedules and maintenance to contact spouses and keep them up to date and involved. By the time the spouse seems to find out anything, it's a day late and $1 short. I feel like they should reach out to us spouses more and make us feel important. Could you tell us what squadron that is? I think we could figure it out. Any thought? Is it maintenance squadron? Ops?
I'm assuming it's either one of our 2, but our key spouses do make every attempt to reach out to the deployed spouses, in accordance with the program. So if I could get some specifics on that, we will definitely take care of that.
Good deal. And we can make sure that all the key spouses reach out again to any new spouses. So we're required, if you don't know, to keep track of those spouses we contact. So sometimes we might find that wires have gotten crossed. Maybe we asked your husband or your wife at work if we could contact you, and maybe they told us one thing, but you would prefer to be contacted. So we can reach out and make sure that we establish the connection. We can at least ask, and then we'll document. If you say no, please don't contact me in the future, we'll document that so that if we get faced with this question, we have a good answer. But we'll reach out to everybody and make sure that we've got 100% contact with the spouses in those squadrons. Fair enough?
Sir, if I
Yes.
could add something.
You bet.
Angie Fields is here. She's our key spouse. If you have something to say, Angie, pertaining to the Key Spouse Program.
Angie, go ahead.
Hello, how are you doing?
Good
These
evening.
spouses are required, by AFI, required to contact family members at least once a month, which we do so. There are some cases where the military member has notated that either we don't have a good phone number or we don't have a good address for their spouses. So some of that does play in the part of that. If we can't get a good contact information, then we cannot necessarily contact the spouses. The Airmen and Family Readiness Center also does programs for all of our spouses that are deployed each month. For example, for the month of June, we did a Camp Christina where we went to Camp Christina in Riverview. So each month, we're contacting all of our deployed families at least twice a month, unless we have bad information. And then if we have bad information, then we're having a harder time. One of my squadrons actually had 5 bad phone numbers for their spouses for this month. And so we have not been able to contact those families yet.
All right, thanks. And I'd also offer up that it's a two-way street. Please, if you feel you're not being contacted, reach out to somebody. Ask your husband or wife to go in and tell their squadron commander, I want to be contacted, but nobody's contacting me. And I guarantee that they'll contact you. All right. We'll go to the next poll question here.
Hey, sir, real quick with regard to the Brandon
You bet.
comment on it. All right, just so everybody knows, with regard to Brandon, we've actually done some great things out there. We've In the last 4 months, we've added 8 new rooms, which 6 are provider rooms. Our staff, which we took a big hit, we lost, actually we had 2 providers quit due to the system network issues that have now been fixed. We've updated the phone system to increase the throughput there, as well as improve the network access, which is our computer systems for the medical record. With regard to providers specifically, we are fully staffed, and we actually have provided an additional provider. And as of yesterday, one of our family practice providers returned from downrange. So Brandon, from a provider perspective, should be well and fixed now.
Good deal. Thanks, Kevin. And something to point out, a lot of folks may not be aware, but our military treatment facility, that's what we call them in the Department of Defense, so our clinic has an enrollment of 40,000 folks. We're just about there. So we are larger than just about every other hospital or clinic in the United States Air Force. So the number of folks that one clinic manages across the greater Tampa Bay region is tremendous. So put the number of comments that we're getting in perspective. Granted, we have a small audience. So also, I'd like to remind everybody that every comment that is raised on Facebook or here through the poll everywhere, we're going to get the answers, and we will put our responses online so that everything is addressed, okay? All right, so for the next question here, my top concern for K-12 education for MacDill families is, and I saw there was a comment early on, was it on middle school?
Yes, sir. It said we need a middle school.
All right, so lack of a quality middle school option. I'm guessing that's for here on base, given the demographics of the audience. So I'll share with you, if you didn't happen to hear, the Hillsborough County School Board met, I think, Tuesday night with Superintendent Mary Ellen Elia. I think Colonel Santana was there and some other folks from the Mission Support Group. So she has offered to convert Tinker Elementary, A-rated school, 3 years running, great principal, into a K-8 middle school. So that meets with approval? Good deal. So your next question will be when, and if I told you 5 years from now, that wouldn't go over so well, but she's looking to do that in 2015. So the goal that we're setting is May 31st for completion. We figured that you'd rather have temporary facilities. The plan is not to have our kids in temporary facilities for classrooms, but those will be like the science lab and the music lab and that kind of thing. So the classrooms will be the main classrooms already in the building, and then this August it'll open up as a K-8. The questions I asked her were, will you peanut butter spread the resources there? Will you take the teachers, same number, and increase the class size? Nope, they're going to fully resource it because Florida law requires them to. So the good thing about that is Tinker is exceptionally well-resourced for military kids. That will save our kids in 5th grade one more transition to another school, which should be great. And it also helps the community here on base. So I know we have a wait list for housing. We're trying to push the requirement to increase the number of houses here on MacDill Air Force Base. That's going to take some more time. So Superintendent Ilya also offered up to have a town hall with everybody who's a MacDill family. And it's not just Tinker and the folks here on the installation. It's throughout Hillsborough County. Would you guys be interested in a town hall with her where she stands up here and answers questions about education from the International Baccalaureate at Robinson to Monroe Middle School? Good deal. She'll be happy to do that. So I'll go back to her and let her know there's interest in that. I think Tinker K-8 will provide that quality middle school option, and she's also said that Lanier Elementary and Monroe Middle School, I guess they share the same plot of land, or they're one campus, or they will be. The plan is to convert that to a K-8 STEM academy, science, technology, engineering, and math. So she also let me know that she doesn't think a lot of military families are familiar with the choice options in Hillsborough County. But the choice options are one of the things she'd like to talk about to educate our families on, because there are a lot more options for middle school, I think, than a lot of folks realize. So kids don't transfer into high schools on an equal playing field. GPAs can't compete with 8.0 GPAs created by weighting classes. I've heard this from a lot of folks with regards to Robinson and the International Baccalaureate. And I will say that a couple of families have come forward and told me that on a case-by-case basis, their unique situations have been addressed, and even at the superintendent level. So they want to work with us on that, but I hear the frustration. So what we're asking the school board to do is to develop a strategy with the base. There has